Okay, I'm going to record this class largely because I'm going to go through some of the software because Amber can't be here. And I'm going to go through some of the software um, after we do a little bit of housekeeping. This is the third week. And we need to, most of you need to catch up on the assignments. One of the reasons I want to go through this is because some of these assignments have been challenging because the software has idiosyncrasies. Some of them can be dealt with. I've been playing with it. I'm going to go back through one of the labs from last week and show how to play with some of that, at least how I think we can play with some of it to make it work. So what I'd like to do that as a part of this class. Then we'll talk about compounding. That's what's going on this week, is compounding. And we'll do that first and then do the labs. Pardon? I emailed it to her. I'll make sure I did, but I'm sure I did. Yeah. Yeah, I just sent that to her a little while ago. Okay. Okay. That would be very nice if you could do that. That would help Amber. One of the issues with this software is that it's training software. No one actually uses it in a pharmacy because all the pharmacies have their own proprietary systems. I tried for several years to get one of the pharmacies to let us have a copy of their system and train people on a live system, thinking that they might be willing to do that because then there would be people that would be trained on their system. No such luck. No one would bite on that one. So and this is about the only thing out there that is actually, that actually does the functionality that you will see in a pharmacy. It tracks inventory, it allows compounding, it can be used in a hospital setting. So it's really a broadly applicable system. As a result, it's also gigantic and complex. So there are some areas where things happen. There are some ways around some of the issues, and so we'll go over some of that today. Some of those things that they have. So I'd like to just talk about compounding first, and then get into some of this software. And I'm going to be projecting it. I will go through some of the assignments, parts of them. But the other thing I'll caution you is that the book is written for about a 1-semester course in pharmacy operations. If you look at it, there's all sorts of instructions for filling a prescription bottle and labeling it and giving it to your instructor. Or in the compounding, it's preparing things like the fake MMR injection syringes, labeling them properly and showing them to your instructor. And then they want you to do 9 or 10 different operations that we don't ask you to do. Your instructions are on the worksheets in each individual lab section. So you only do what they ask you to. But please do what they ask you to and use that template that we give you, because that makes it much easier for me to grade, but it also makes it easier for you to see what we expect you to do. Normally speaking, these labs can take quite a bit of time. And when we have done more in the previous edition, it was actually much less complete than this edition. And still, we would spend sometimes several hours working on labs. So, in a class. So, what I want you to do is just be careful that you follow the instructions on the worksheet templates that we give you. Do only that, instead of going on and doing all the things that are in the actual work text. There are some areas where it doesn't work quite right, and part of that is because, especially in the refills, this software was published last year, 2018. The database that it's based on was created actually in 2017 and possibly a little bit in 2018. So a lot of prescriptions, when you go through and you're asked to refill them, and one of the labs this week is actually refilling for a nursing home, doing a batch refill for a nursing home. A lot of the refills are going to say, you can't do this, it's expired. So I can show you what to do with that to potentially force it to work. Now, if boxes won't check, I don't know about that one. I haven't been able to figure a workaround on that. What I will say is, if you run into something and you can't find a way around it, give me a screenshot of the last screen you could get to, and let me know that that's as far as you could get, that you couldn't go any further. And that will help me understand, because I'm trying to keep some notes on this and pass it up the line to people who may be able to get these vendors to fix this and make it work better. The problem is the basic database that they use for the patients is very large. And to try and go through and do changes that would make this essentially a database that was usable in any one class time is really a rather daunting project. And I can't imagine that they would do it. I certainly would say, well, deal with it. So there are several ways of actually doing that. So we'll discuss a few of them today. Anyway, compounding. Compounding used to be the way all pharmacies worked. We didn't really have dosage forms like tablets until the latter part of the 19th century. Well, we actually had them a long time, but we didn't have automated machines, and so we didn't have mass production. You may remember, I don't know if you guys were in the classes where I talked about the history of the development of the tableting machine, but that came about at a time when pharmacists were basically, most of what they were making at that time was tablets of aspirin, because that was one of the few products available. And they could make a couple of hundred at a time, and it would take about a day to do it. And so the advent of a tableting machine meant that thousands and thousands a day could be manufactured very quickly. And as a result, that set us on the course that we have been on ever since in the pharmaceutical arena, where we can make large numbers of things. It took a lot of business away from pharmacists. There was a lot of anger in the pharmacy community when this started happening, because their business was being taken away. Now the pharmacy has evolved into a partnership with the pharmaceutical industry, because pharmacists are not allowed to duplicate a product commercially manufactured. Those are proprietary products. So a pharmacist, even though they can, they are not allowed to. However, there are many, many ways to formulate drugs. Pharmaceutical companies only manufacture those things they're going to sell in sufficient quantity to make money. So what happens is that occasionally, actually surprisingly often, people need to have special formulations. They might be allergic to one of the components of one of the pharmaceutical company's products, which means that if they need that particular drug, they have to have it made without whatever component that they're allergic to. That's where a compounding pharmacy comes in. Compounding pharmacies exist everywhere. All of the major chains have compounding centers. Even your small local pharmacy will do some compounding. They'll do some mixtures. Those of you who remember from your kids getting amoxicillin suspension, that comes as a powder into the pharmacy. The pharmacy has to reconstitute it, has to add distilled water to it, and that's compounding. Okay. Now, pharmaceutical products are manufactured following after a development process in which they experimentally determine the stability of their product. You see these dates on packaging of pharmaceutical products. There's a couple of factors there. The pharmaceutical companies during drug development will do a lot of, they set aside samples of every batch they make. Even after they're manufactured, they set aside samples and they test them regularly. And they're looking for any change in the product. Maybe it gets a little darker over time because one of the dyes that's used in the coating oxidizes. That's a change. We don't know how that affects the product. Chances are very high that it has no effect at all on the product. But any change means that the product cannot be used, cannot be sold. So they look for that, and they look for up to 5 years. Now, the FDA has put a 5-year cap on the shelf life of a product. But I think I've told you guys before that I have some aspirin on my shelf, Emprin brand. It was sold, Emprin was a trademark of the company I worked for, Burroughs Wellcome, that the expiration date on it was 1985. It's still perfectly good. How do I know it's perfectly good? Well, because when aspirin decomposes, you get a strong vinegar smell, much stronger than when you have a fresh bottle. When it really smells strongly of vinegar, you probably need to get rid of it. If it doesn't, perfectly good. Another good example is vitamin C. Everybody thought vitamin C was some mystical product that the body produced, and it produced it and it eventually decomposed. It took many, many years to develop the technology in chemistry to be able to analyze what vitamin C is. And it turned out to be ascorbic acid, something that sits on the shelf for 20 years without changing. So, but still, your vitamin C products that are sold in the stores have a 5-year expiration date, after which they cannot be sold commercially. And unfortunately, even though these products are perfectly good, the pharmaceutical companies and the chain pharmacies and other things that have them cannot donate them to the third world or other places that need these things, because unfortunately, they used to do that. And unfortunately, there was such a ruckus raised by people who didn't understand and accused these companies of dumping bad drugs on the third world when every single one of them was perfectly useful. So it actually did a lot of damage to have that ruckus kicked up about that. But these things last a long time. However, this is all experimentally determined. The drug companies will sit there and for those 5 years, they will analyze every 3 months, they'll analyze the product to see if there are any changes. And they do that during the lifetime of the product as well. They analyze every single batch, every quarter for up to 5 years. And that's why we get recalls periodically. When a company recalls a product, it usually isn't because there's a problem with the product. It's because it's begun to decompose some beyond a limit that's acceptable. So it's lost some potency, or it's changed colors, or something has happened that is not medically important, but they still have to pull it off the market. But for the most part, these things are rock stable for at least 5 years. So, but we can't do that when we compound. By compounding, even reconstituting amoxicillin with distilled water, we change the product. Water itself is a very, very nasty substance. Now, we also know that, of course, it's critical to life, but it's very destructive. And I'm not talking about flooding or any of that. I'm talking about chemically. It tears things apart. So what we have is a rule of thumb. We have, instead of having an expiration date on a compounded product, we put what we call a beyond use date, meaning that after this date, you must throw it away. And you see that on your amoxicillin. The label will say use within 14 days and then discard the remainder. That's because the guidelines that we have from the United States Pharmacopoeia, which is the sort of Bible of compounding, goes back a long time, back into the 18th century, actually. I have a copy of the 1894 version at home. It has some very interesting recipes in it, many of which, if I tried to make today, I'd be arrested for, because they're cocaine and heroin and morphine recipes. But those drugs, until the 1930s, those drugs were perfectly legal to use and prescribe. But this has been around for a while. And what the USP puts on water-containing compounded products is a 2-week beyond use date. Now, there are some products where people have gone to the trouble of doing the experimentation and showing that they're stable for longer than that. But those are not really common. It's a lot of work and a lot of effort to do that kind of experimentation. Non-water containing ointments, creams, lotions, and stuff like that, non-water containing products have a beyond use date of either 6 months or the earliest to expire component. Everything we buy that goes into our compounding comes with an expiration date, because that's also been experimentally determined. So they all come with expiration dates. So we record in our batch records or our compounding records or compounding form, whatever people call it. in your specific organization, but we keep a record of everything we formulate. We list the steps we take because, quite frankly, because if something goes wrong and a patient is harmed by one of those products, we can show that we reconstituted everything perfectly, that we followed the standard directions, either on the label of the product. Amoxicillin little bottles come in little plastic bottles about this tall. And they have instructions on the outside as to how to reconstitute them. In a hospital setting, when you're reconstituting things that come as sterile powders so that you can dissolve them and then put them into IV bags, they too often will have the instructions written on the bottle. Why is that? Because the pharmaceutical company wants you to do it the same way all the time, because they're the people that are going to get gone after if there's a problem with the product and with what's being dosed. But we also have these, we also have standard recipes. Some organizations will have their own standard recipe book. It's almost always based on the United States Pharmacopoeia / National Formulary document that is, as I said, the Bible of compounding. It is the USP is a not-for-profit quality assurance organization whose goal is to make certain that every compounded product that is made in this country, or actually it's really a widespread document, but it mainly applies here. It's the United States Pharmacopoeia. Everything is done the same way so that we can actually trust what you get from one pharmacy and then go across the country and need a similar product and get the same thing there. So what we have is that. So we have, you will see the term BUD, or beyond use date, in these labs. So we do have to put what amounts to an expiration date on our products that we compound. And that is governed by the rules. There are different rules for sterile products. We talked about that in another class, I believe. But there are very different rules for sterile products because of the patient risk. And there's some levels of that we won't be going into in here in this class. But you can always refer to these. You can either do a search, a web search for beyond use dates, and come up with some links that'll show you those, or you can remember what we've been saying here. But compounding is the process of making something that's not commercially available. This can be a dosage form, even of a patented drug, a non-generic drug. There are patients who are going to be allergic, because patients can be allergic to anything. There are patients who will be allergic to some of the components of these things. So what we do is a doctor, will write out a prescription for a drug or for a tablet. One of the ones I know about is a couple of patients down in Denver who were clients of the compounding pharmacy that's in the same office complex as College America's building down there, were allergic to some component of standard levothyroxine. Levothyroxine is currently the most commonly prescribed drug in the United States. More prescriptions are written. I see Amber's online. Good. Welcome, Amber. We got started. You can look at the beginning of the recording later or when you feel better, okay? These patients were allergic to some component of thyroxine, and so they were consistently and constantly making batches of thyroxine tablets without that component in this pharmacy. He also had a sterile products lab. You all know sterile products are a lot harder to deal with. You need to have the right facilities to do sterile compounding. He also had a sterile facility within his pharmacy that was that produced some very interesting products. So they produce. There are products that people need, specialty products, lip balms. One of the labs we used to do, well, we did a lip balm lab here. We did a little more complicated one down in Denver because I had the components for it. But people will have medicated topical products that aren't available from any commercial source. Another major place where this happens is in pediatric dosing. Most pharmaceutical companies are still hesitant to try and do clinical trials in pediatric patients because children and babies, of course, can't sign consent forms for participating in something like that, so their parents have to. And also, babies treat drugs differently. They haven't beaten up their livers like those of us who have lived a little longer, among other things. Plus, their various metabolic systems aren't fully developed. So they treat drugs differently. And as a consequence, besides the fact that they're smaller, and drugs work by having what we call a therapeutic plasma level available. Children are smaller, so smaller doses will give them the dose they want. A lot of drug companies don't make formulations that are easily divisible into a children's dose. So occasionally you'll have to have someone make up a low strength form or a small amount of drug for a child. That's another place that it happens. Another area where formulation is common is in cancer chemotherapy drug mixtures. Cancer oncologists, therapeutic oncologists are kind of cowboys. They really are aggressive about what they do, and they often want special mixtures for their patients. Chemo compounding is a specialty because chemo drugs, by definition, are very toxic. So, we don't like our technicians handling them casually and unnecessarily. Felicia.
Like really dangerous too. If it gets on your skin, I guess it can like annoy your skin.
Some of them are pretty bad. Some of the mustards are bad.
Meanwhile, this lady does not want to wait for us to go through all that.
Yeah.
She's like 80 pounds, so half her weight is 50.
Yeah. Yeah, well, it's probably a side effect of the drug she's taking. Cancer compounding is a specialty. Another place that's a very high level specialty is in the use of radioactive imaging agents, which we use for diagnostic purposes. Those have to be basically prepared and used right away.
because they're by definition, they decompose at a specified rate. So a lot of that goes on, and it is so there's a lot of compounding activity. Another thing is that a number of treatments for oral conditions, we want to have a localized treatment. So we've got mouthwashes that people will make up, specialty mouthwashes. We have something that you'll see in the labs this week, something called a troche, Troche, which basically is a sort of disc-shaped lozenge, sort of a pie plate shaped lozenge, which we will keep, often is put between cheek and gum, or under the tongue, so either sublingually or buccally, to deliver something local for a local condition. Another thing that we often will see is that we'll have specialty formulations of suppositories that people will use. So there are a number of places where this goes on. Many of these things can be done at your local community pharmacy. Most of them will not have that facility because having the facility means requires having hoods and other safe places to work, and requires specialized equipment that needs to be properly cleaned. Some things like suppositories can either be done in little plastic pull-apart devices that you simply throw away, or in metal frame molds that you clean. So a lot of places won't be doing that. Creams and ointments are another specialty and product, and they're made by taking a base and mixing it with an active ingredient or more than one active ingredient, and then properly they're run through an ointment mill, which is basically two marble rollers put together, and they're touching, where you really grind up and mix everything, and you make the particles of your drug very, very small. They often won't dissolve in the ointment, but they'll suspend well. But we do this because we want a uniform mixture and absolutely no lumps throughout. So there's some specialized equipment involved in all of this. Any full functional compounding pharmacy will have it all. And it can be an expensive operation to run. The one I used to take my students to down in Denver had all of that capability, and fortunately, the pharmacist that owned it welcomed us in. If we came over during his working hours. So we were able to visit that. There are compounding pharmacies up here in northern Colorado. I have not looked them up, but there are compounders here in Fort Collins. And they really do have a good operation. So anyway, questions, comments? Now, you all know that I'm a chemist by education. So compounding has always been something that's been of much greater interest to me than filling bottles of pills. So you know, I find it, I find the variation of jobs that need to be done to be very, very enjoyable. And compounding is a lot like chemistry. Um, and so when I've had a chance to do some of that, I really enjoyed it. So so that's really what we're looking at here. This week's discussion is about compounding and about how a compounding request is handled in the pharmacy. If you haven't had a chance to listen to or watch the video in this week's discussion, I'll be very interested in what you have to say about it. The basic premise is that a woman brings in a compounding order just before the pharmacy is about to close, and we see how the technician handles it. So that's as far as I'll go with that. So it's actually kind of a funny video to watch because it's so completely outlandish, but it unfortunately is something that you know, every single thing in there has happened, just not necessarily by the same person in the span of 3 minutes. But nonetheless, it's worth looking at and thinking about. But compounding, it's one thing. You've all been through the pill counting exercise. You know, no big deal there. You pour them out onto a counting tray, count them into the side slot, return the unneeded drug to the bottle, and then fill up the prescription bottle. You never physically touch a tablet or a capsule. Compounding takes a lot longer. Often compounds mixtures can be a half a dozen or more different components, each of which has to be recorded. And when we're talking about recording them, we're talking about recording what they are, who the manufacturer was, what the National Drug Code, the NDC, is. Remember, the NDC is a 3-component code. The first component defines the drug, can be up to 5 characters. The second component is 2 characters that tells you who the manufacturer is, and the last component tells you the package size. So and it's unique. Even if you're talking about generics of the exact same drug, as long as they're made by a different company, they have a different NDC in some way. If nothing else, then the manufacturer identifier. So so you record the NDC, you record the expiration date of that component. Everything that we use in a compounding pharmacy has an expiration date, even distilled water. If you're at the Kroger or King Super pharmacy, you probably are using distilled water off the shelf at the store. But it has a date on it, so you have to list that. You record the amounts of each, and my preference, and I think that's generally the way we want it done, the order in which you mix them. That can be important. If you are mixing something that is not going to mix well, you have to make, say, an emulsion. The last thing you want to add is the oil part, the fatty part, because everything else needs to be fully dissolved in the water. And then you add the part that isn't mixable with water. And usually you'll emulsify it in some way. Often with a device that looks an awful lot like a milkshake machine at the local ice cream store. So all of these things go into it. So it takes time. It takes planning, and you have to keep records. Also remember that you as a technician, you can't just make it up and hand it to the patient. It has to be approved by the pharmacist, who will go over your compounding record, who will go over everything you've done and make sure that everything is written down properly, and then approve it. So compounding takes a little time. So if someone comes into a pharmacy 15 minutes before closing time with a 6-component ointment that they need, well, they're out of luck. It isn't going to happen that night. We don't have, used to be there were a lot more 24-hour pharmacies. But now, I know from Loveland, we're told that if you want to go to a 24-hour pharmacy, you go to Longmont. Yeah. So I look at that and say, well, I guess I'll avoid 24-hour pharmacies. But I have walked into pharmacies to fill regular prescriptions for family members at 10 minutes to closing time and been served, because usually by that time I am the customer. So it's not a big deal, but we do have that. So let's go on to all right, let's go into this. All right, so this week our in-class activity will be a little different. I'll tell you about it on Wednesday. It's going to be a little different. I thought you'd like a break from crazy prescriptions. So we'll do something a little different this week in class. But we will have one. The assignments really are about compounding. And we'll go through a couple of them to show you the screens that are used and how they're used, because unfortunately the instructions are written in a way that is not necessarily intuitively obvious. But I'm going to back up and go into, what was the one we were having trouble with last week? Was it B? Oh, let's go into B. Great. Okay, let's do that. Yes.
For A, part 2 of A, it says, where we go? Nancy Davis for her Ventolin inhaler. When I type in Ventolin inhaler, Google comes up and it doesn't show the package there. So sorry.
Okay, let's look at that too on break. But if I want to bring up this Word document. Let's see, yeah, we'll bring that up. I want to bring up this Word document here for Part B of last week's assignment. Thank you, Felicia. So what we have here is we're doing, it tells us exactly what they want us to do. So we've got, and it's all here, Lab 11. As I said before, if you reach a point where you just can't go any further, take that screenshot and tell me that. Because first off, this is not supposed to be an exercise in software management. This is supposed to be an exercise in application. Second off, it's not supposed to be an exercise in frustration. It's not worth it. So please don't waste that emotion. So we're going to go over here and start with lab 11. So I'm going to call up may have to do this as a new share. Yep. I'm going to call this up. And I'm going to get out of all this stuff. Okay. So what we want to do is look at that. And it's going to, I'm going to be going back and forth a lot here and doing a lot of new screen shares. We're going to go back to lab 11. Okay. So we will put, we'll do, we'll go over here and we're going to have a refill. And we're going to start that. We're going to start with Mr. Ronald Jackson here. So we're going to call up, and again, I'll do the shares. We're going to call up Ronald Jackson's history. When we do this, when we're doing a refill or when we want to know what a customer is taking, if we want to list do a report on a customer history, we go to customer history, and as usual, we type in the first 3 letters of the last name, press return, and here we have Ronald Jackson. Now we can either click this and then click OK, or we can double click on Jackson and bring it up. Okay. So here we have Jackson, and we have 6 prescriptions. Right away, one of them we know cannot be refilled. How do I know that? It's a narcotic. It says over right here, narc filled. So it can't be refilled. So we already know that one's not eligible for refilling. So let's take a look at refilling something like Jackson's hydrochlorothiazide. So we click on that, and then we go up here to fill RX. Now, we can click on 5 or 6 of these. And as we go through and fill one, it'll automatically go to the next. But I'm just going to do the one now. So it's going to say fill RX. Okay, it says expired. So we're going to refill the expired prescription. It automatically fills it in. That's all you have to do. Now, that assumes you can make it click in the box. And that was a problem Hope was having last week. And I watched her try, and it would just ignore things. So, yeah. So there's a couple of other things. You will see sometimes things will come up and say error. I was working on one of today's labs and got this error message. Absolutely meaningless. Error number 107. Oh, goody. You know, that's really explanatory. And then it says, you know, operator operand error. Oh boy, that's real explanatory. You know, and then a bunch of numbers, a bunch of terms, none of which made any sense. So there is, you can ignore those things. There's an ignore button on many of them. Press it. You may have to press it 3 or 4 times. But eventually it'll wake up and say, oh, I guess you really mean it, and then disappear. And then you can go on to the next step. Okay? So here we have Ron's prescription. So what we want to do here is note the prescription number, 186482. I'm going to write that down. Okay, we note that. So let's go ahead and transmit and record it. So now we have this status paid. So it's accepted. All right. So now we close out of that screen. If you guys want to take screenshots of every screen you come to and post them, that's fine with me. All right. So I'm going to close out of that. And then we're going to have nothing showing. So now we want to close this and print the label. Note this screen that comes up that says, and I think this is sharing, isn't it? Yes, it is. Thank you. So that Amber can see it. So here in the box labeled RX number, we simply type in 186482. And if we click down here on fill date, it comes up with today. So don't try to print. You'll get a message that says you don't have a printer, and then it'll disappear. Do the preview. And there's what you take your screenshot of. Hey, Cody. Everybody fine? Yeah, I see that. That says maybe there's an issue. Ah, congratulations. Congratulations. That's wonderful. I will tell you the ultimate horror story. Yeah, the ultimate horror story. A couple in North Carolina wanted to adopt twins. They couldn't have babies. They had tried for years, could not have a baby. Wanted to adopt twins. And finally, they got cleared and got permission, and they got a phone call and said, "We have your twins." Oh, great. You can come down and see them, blah, blah, blah. And then they get another phone call. "We made a mistake. We actually assigned you 2 pair of twins. Do you want them?" "Yeah, sure." Then she got pregnant and had triplets. 7 babies under a year.
Here we go.
That's when you know that God has a sense of humor. Yeah, we'll give you a batch of them. Anyway. Yeah, no kidding. Yeah, as I said, ultimate horror story. Yeah, yeah. At any rate, so that's one of the things you can do to get around some of these glitches. Remember, there's ignore and there's fill it anyway. That allows you to do these things, and that'll work. At least it did. You may want to try that, Hope, and see if that works for you. So that's something. We are now at 7 p.m. It's time for our first break. Amber, I'm going to pause the recording until after the break. You don't need to see a blank screen for 10 minutes. So
Okay.
we'll be back online shortly.
Okay.
We're going to do part A of this week's assignment. We're going to get started on that. If we bring up the we bring up the assignment, it takes us to Lab 21, where we're going to do immunization syringes. Note that there is no, that's the only thing we're going to do with this lab. So we're going to go in here to Lab 21. So I'm going to go back now and bring up lab 21. Okay. And we're going to go to go to that one. Okay, so the theory here is that we have to look at preparing syringes for immunization. Immunizations are now done in most pharmacies. So we can go in there, make an appointment with the pharmacist, and they'll have it prepared. But the issue with compounding is that the first thing we have to do is actually create the drug. So that's the first thing we do. So at the beginning of this lab, and as I said, we're only going to do a little bit here. The beginning of this lab, we're going to create a drug. So when we go into the drug tab within Visual Superscript, the first thing we get is 3-day vaginal cream. Well, that's because in the listing, the database, it's the first entry. So it starts at the top of the database. So what we're going to do is create a new drug by clicking the new box, and then create this drug. And I've already done that, so I'm just going to bring it up. And that we don't have to worry about. We'll do that. We start by going to drug. We're going to create a new drug. And that new drug will be MMR-SYRINGE. Now, that already exists, so that's what you'd start off typing. I'm going to close that. No, I'm not going to do that. Close it. No. No. And what I'm going to do is search for MMR. So I get MMR syringe, double click on it, and this is the information that gets typed in. We give it a quick code. Quick codes are useful, then you don't have to type everything. You don't need a quick code. They're just useful. It is prescription only. So in this field, I'm going to edit this so we can actually pull some of these out. In this field, you have a choice. You'll see that it is controlled substance, schedule 2, 3, 4, or 5, over the counter, or RX. We've chosen RX. We are compounding. We actually have a number of different classes: durable medical equipment, a maintenance drug, regular drug, rental, supply item, or compound. Well, we went compound. Can be used by both genders. There are some drugs that clearly are gender specific. Yeah, vaginal cream would be gender specific. A prostate specific drug would be gender specific. So, and then whether it's brand or generic, and generic is fine. We were told that the instructions to the patient were use as directed within 8 hours. So that goes on the label as the default SIG. The drug unit, the drug is calculated in milliliters. So you see each, which is things like a suppository or something like that would be each, or gram or milliliter. So we're using milliliters. The units of the product are going to be in milliliters. We have a choice here: milliliters, ounces, suppository, syringe, tabs, vial. The unit could also be a syringe, because that's what we're preparing. Okay. Package size. we're going to put in 1/2 milliliter, so 0.5. Forget the days to expire. So then we save this. We save the drug. Immediately leaves us with the screen filled out. When we want to compound it, we have to go down to the bottom quarter of this panel, and you'll see manufacturer and available NDCs. You'll see the manufacturer is this pharmacy. A compounded drug is manufactured by this pharmacy. If you were working at a Walgreens, it would be Walgreens number 683 or whatever. NDC numbers for compounded drugs are all zips. 5 zeros, 4 zeros, 2 zeros. So here, so we click, go ahead. NDCs are assigned by the FDA. Yeah. Yeah, everyone that you manufacture has it's not a national drug code because it's not nationally distributed. It's only used locally. Okay. So then we click on compound drug ingredients. Okay. And here's where we add things to it. We add things, it tells you to click the new button. This is not the one up here. We have, when we're working in this bottom quarter, the buttons that count are here at the bottom. So we have new, and then we type in. Now, what came up is, I want you to clearly see this. What came up was actually 2 different fields, okay? What came up was the compound drug ingredients, the drug name, and now the ingredient drug name, okay, is hidden. So we're going to type in MMR, and there's nothing there. We don't have MMR. So let's try something else. MEA, nothing for measles, okay, it's not there. So there is a glitch that we have right away. We don't have anything to put in our database. Okay. So we're going to cancel that out, and we can just leave this as is. This is going to give us errors later. I'll show you that later, and I'm sure this is really the problem with it. You'll note down here in this bottom quarter that there is a calculate price button. Your book doesn't tell you to do this, but after you get all the components in the list, before you save it, calculate the price. Okay? That too can cause errors later on. So now we've got our drug in, okay? And we want to go to giving giving this to a patient. That's the second half of our assignment here. No, that's part B, FUI. Okay, the second part is to, what we want to do is provide a print screen of the prescription label from Revista Sandoval. Okay, so I'm going to go back to where we were. Oh, why are you being uncooperative? All right, I'm going to go back here. So now we are done with this. We close it and we do a fill RX. So we want a new RX. go over here. We want Aravista Sandoval. So we type in the first 3 letters of the last name. We find a whole bunch of SANs. Here is her. And double click it and it fills everything out, and we can simply put the drug in. If I try to put this in, it's going to give me an error, but I'll just show you this. Okay. So we have the MMR syringe. Here's our error. Okay. So ignore, 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 ignore. And now we have a drug history. Just click ignore repeatedly. I'm sorry. I added the drug over here. See where the finger is pointing at the drug name? I added the drug there. Okay. Okay. So then I got an error. When you get that error, if you get that one, same one, just ignore. You have to click it 4 times. And then we come up with a drug history, and we can close that. Prescribed quantity is 1. Dispensed quantity is 1. And remaining quantity we don't care about. We only made 1, so it's 0. Okay. So now we record, prescribed days supply. Excuse me, I left out a field. That's easy to do. Dispense days supply. We'll tab down to that, and it's a 1. And now we will transmit. And we need to find that prescription number. Now, before, when I did this once before, so what we want to do now is close out of here and then print RX label, and we have prescription number. And as I recall, mine was, and you have to record your own because it's going to be different, because I've done a lot of prescriptions. 186537, I believe is what it was. And we get a dispense date, 204-2019. Should have been done. And do a preview, RX not found. All right, so that didn't work. So what we want to do in that case is go back and do a customer history on Sandoval. And what we find is an MMR syringe. We have a, 186538, so I had the wrong number. So I can go in now and now close out of this, cancel, and close out of this, and do a print label and an RX number of 186538. We click in the fill date and it fills it in, and do the preview, and there we have it. Interesting little sidelight is obviously in the system with Mrs. Sandoval, it says that her preferred language is Spanish. Because if you look at this label on the left side, Usai is correct within 8 hours. A little bit of mixed English and Spanish there, but it is, so it has put in, it has translated this because somewhere in the system, it's noted that her preferred language. Okay. That's one of the other strengths here in this, because that's what all these systems have. They have an enormous range of languages and alphabets. You can print labels, but one of the labels printed will always be in the dominant language. Okay. I said dominant because we don't really, believe it or not, we don't have an official language in the United States. Not legally. It's just that English is the dominant language. So this is what you take a picture of and submit for that assignment. Okay. Now we're going to get out of this. And cancel out of that. And now we're going to go back to looking at the next assignment because it's going to enable us to actually look at some more compounding. No, that's the wrong one. That's week 2. Okay, so here's B for week 3. All right. All right. This is a little more complicated. Let's look at this one. We're looking at lab 22, which is extemporaneous compounding. Extemporaneous compounding is as opposed to sterile compounding. Sterile compounding is a whole different realm. And in fact, if you do sterile compounding, you're going to be certified as a sterile compounding tech, and it can significantly increase your compensation level by getting that certification. But we're going to do 2 labs here. I'm only going to do, I'm going to work with the first one here, which is just one. There is essentially no practical limit to the number of components that can go into one of these compoundings. The first one we're going to do has 2 components, but you can keep on adding as many components as you need. All right. So we're going to create something different here. Oh, you're coming up where you can see better. That's fine. Great. Okay. So now we're going to go back to lab 22. First thing I'm going to do is share this. Okay, lab 22, extemporaneous compounding. So what we're going to do is, again, create a drug. So what's the drug we're going to create? It's going to be something called Anna's Anti-Wrinkle Cream. I'm going to give it a different name. I'm going to call it Judy's Anti-Wrinkle Cream because I've already done Anna's. So we can do this right from scratch, okay? So that's the first thing we're going to create. So let's go back to Visual Superscript and do the share. And a drug and new. And this is going to be, notice that I don't use FDB standard name. Always use label name. Okay? So we have Judy's. Oh, close it. And then new drug and then search. Okay. Judy's Wrinkle Cream. Yeah. Oh, you wanted to do a search. You said the magnifying glass? Yeah, so you close it out and then bring up drugs and do a search. And then just type in the name that you're looking for. So I'm going to give it a quick code of Judy. The drug class is going to be RX. The item type is going to be compound. Gender is both, and generic is fine. Okay, so I've got that. The SIG was supposed to be apply to affected area. So we'll do that. Okay, the drug unit in this case is grams, and the units that we'll be working with in general will be grams. So we do that, and that's all we need for this. Okay, great, great, fine. We want grams and we want other things. Doesn't matter. Yeah, you can leave that. Okay. So if we go back and take a quick look at the instructions, package size is not even mentioned. So what we're going to do now is save it. We have our save button. Save it now, and note that just because we've saved it, it doesn't disappear. So now we can continue to work with it. We just want to be sure we save it regularly. So we go down now to the bottom quarter where we have the 3 tabs: manufacturer and available NDCs, compound drug ingredients, and third-party NDC preferences. Ignore those outer 2. We're concentrating on the middle. So our compound drug ingredients go here. First thing we want to do is add a new one, okay? So what we want to be adding, and I'm going back now and I'll change the share on this. Come on. So we want a new share. And we want the here. So we click on that. We want to enter TRET for tretinoin 0.05% cream. And we want the 45-gram package size. So now we're going to go back to the other screen. And we're going to type in TRE. Now, normally you note that we would type in 3 letters. In this case, we're going to type in 4 and just reduce the choices. So we want 0.05% cream. So we keep going until we find the 45-gram package. And we double click on that. That screen disappeared, that little box disappeared, and we're now down to the compound drug ingredients box. Okay, the quantity we want is 2.5 grams. Okay, so we type in 2.5. Note that we don't type G or anything else. Just, we've already told it that it's measured in grams, right? So now we save that, and that's our first ingredient. Our second ingredient is water. So we type in WAT for water for injection. And we have, that's what we want, water for injection. It's sterile water. But, pardon? I clicked on the new down here at the bottom. See where my cursor is? Yeah. Okay. So we want the 5 milliliter vial. Why do I know it's 5 milliliters? Because it's water. It's a liquid, right? Double click that. The quantity we want is 0.02 milliliters, right? So we save that. So now we have these. Those are the two components. If I click calculate a price, note it puts numbers in here. And what it puts in is the proportional price of the product in the vial. So we're not paying $11.74. We're paying for only 2.5 grams, and we're paying that $11.74. The 45 grams is like 18 times that. Pardon? Didn't come across? Oh, it didn't come. You didn't get a cost when you pushed it. Well, yeah, that's okay. It doesn't actually require you to do that, but it's a good idea. So now we have finished with this. That's your screenshot. Okay, so we save that, and let's go back to the instructions. Well, I've got those up, so let's do a new share. Week 3, provide a print screen of that. Okay, so now we're going down to lab 20. So you're having trouble on 23? Okay, so let's take a look at 23. Let's keep on going down. Your compound record down here, 23, you're going to create that. Yeah, I'm in Word now. I'm in the assignment now. Okay, you're going to create this information. Okay, prescription number or ID assigned. Okay, so that comes off your there. FR record used. Don't worry about that. That's the formulation record. Name and strength of compound. Okay, that's where you put your, pardon? No, these are the components that you're putting in. In this particular case, we were using nitrobid 2% in this lab. So that's what goes there. We also were using a base, an ointment base, DD ointment base. So that goes there. The quantity, we'll go through how that's calculated in a minute, of both of those. Actual net measurement should be the same for each one. Expiration date off the package. Here, we should have an expiration date on that, and we have 5/05 of 2025. We should be able to get an expiration date for the petroleum base. We have expiration 02/2022. So you're provided with the labels you need to do this. So you can get the expiration dates. Manufacturer's lot number, those are there. Remember, a manufacturer puts a lot number on everything. Used by, beyond use date or use by date, assigned is assigned by you. Remember what the rules are. This is an ointment and a cream, or 2 ointments mixed together. So it's not aqueous. So it has a 6-month expiration date from today, the day you formulate it. And that 6 months is long before the 2 components expire. Now, why can't we just take the earlier to expire component? And the reason is we don't know that these are compatible for that long. So the 6-month date is what you would use, and it would be from now. So here we're in month 2, so it's going to be in month 8. So it'd be 8 of 2019. Date packaged, your initials, and you can just ignore or put in my initials for RPH, registered pharmacist. Okay, so let's go to the actual lab. Creating the record is just filling out that form, okay? Let's go to the actual lab and look at the problems you might run into there. So I want to go back now to yeah, we are doing something very similar again, for sure. Let's do a new share. Okay, so we want to go over to lab 22. Note that lab 21 still had a lot more things going in it that you were going to do. One of the things that happens is after, you may see this, after you create a drug, you may have to write a prescription. You may have to fill a prescription using it. That's what you do with the, that's what you did with the syringe, the MMR syringe. We filled a prescription. Okay. So you will have to do that sometimes after you do that, but follow the instructions here. So preparing and processing ointments. So again, we'll be doing much the same thing. We're going to create a This is 22. Yeah, you go back to 21 partially. Where? Well, I'll tell you what. That's a mistake. It's using the steps in lab 21 because you're in 22, right? You're in 22. Yeah, that would be, I didn't notice that. Thank you for pointing that out. Typos, okay? So in this particular case, we're going to create a nitroglycerin ointment, a 0.2% nitro ointment. We're going to make 60 grams of it. That's what's specified by the doctor. And the SIG is apply 1/2 inch every 8 hours, right? So the components to make this is one of my problems with this lab. I'll have to admit, they don't explain things very well. The components you're going to use to make this ointment, after you create the drug itself, because the 0.2% nitro ointment doesn't exist in your database yet. After you do that, you're going to then save all that, fill out that top part of that form, then save it and go down to the bottom to the compounding. Pardon? We'll do it together. We'll go through that. Now, what they don't do a good job of telling you, and I'll warn you that right now, is that you will be starting with 2% nitroglycerin cream. So what we have to do is calculate how much 2% nitroglycerin cream is required to give us the amount of nitroglycerin that's going to go into 60 grams of the 0.2%. So they've set up a little proportional equation down here. 0.2% of 60 grams, that's what we're making, right? Is the amount of nitroglycerin there, or the amount of the other one, is the same as 2% of X grams. Okay? Because the material that we're taking it out of is 2%. So if we solve that algebraically, remember how to do that. We simply divide everything by 2%. Okay? We find out that we need 6 grams of 2% nitroglycerin in this 60 grams of total drug that we're making, which means the other 54 have to be base, ointment base. Does that make sense? Okay, so that's the calculation. There's a mistake here. They tell you that you need 2 tubes of 3 gram tubes of nitroglycerin ointment. That doesn't appear in our database. We have 1 gram tubes, 30 gram tubes, and 60 gram volumes of that. You can choose whichever one you want. Okay? You can take 6 1 gram units, or you can take 6 grams out of a 30 gram unit. Doesn't matter. Okay? It may matter from a cost standpoint. The search for, I want to go back and just do this. CMPNITR, I don't think exists in the database. So I'm going to go back to Visual Superscript and look for it in drugs. And I'm going to do that, drug. All right, I'm going to search. So it's going to be, it was CMPNITR. CMP, not there. So there's another mistake. So ignore that part of the instructions. Okay, so we're going to cancel, and we're going to cancel, and then we're going to go back to here and go back to the screen share. All right, so what we're going to do here now is create a drug. So what we want, so what we want to do is create that drug using the method that we learned in Lab 22. So we're going back to Visual Superscript, and we are going to, again, do a new share, and we're going to do a drug, and we're going to do a new drug. Going to create, and I'm going to call this a little different because I've already created it. If I were you, I'd call it 0.2% nitro ointment. I'm going to call it nitro ointment 0.2%. Okay. And I'm going to call it NTGOINT as a quick code. Now, I believe they tell us to give it an alchemy ID. I don't know if this was, that might be another lab. Alchemy is something that you just have to use when you see it. It's actually a database that's independent of the rest of this. So we're not going to do that. So we're going to go back over here and now go back to looking at this. Drug class, it is RX. Item type, it's compound. Gender, both. I don't care about generic. And the SIG was to apply 1/2 inch, half inch every 8 hours. Okay, the drug unit is going to be in grams. And the units of the product will be in grams. Where are grams? There. Grams. Okay. So that's all we need. So I want to save that. I'm not going anywhere. I'm saving that now that I've created the drug. Again, note, the first thing when you're doing compounding is create your drug entry. Step one, always save that drug entry, but stay on the same screen. You're not going to create a new drug in the next steps. What you're going to do is formulate it. Right. So now we go back. We have saved it. We now do compound drug ingredients. And the first thing we do is new. And the name we want is nitroglycerin. We want nitrobid 2% ointment. Note there is no 3-gram tube. We've got 30 and 1 and 60. So I'm going to choose the 30. Why? Because we're going to use a bunch of it ultimately. And the other is it's cheaper in bulk. So if I double click on that, it automatically moves it into here. Now note that I wanted, we calculated I wanted 6 grams. So type in a 6, and now we save it. And so now we have that. Our next new item is going to be DD ointment base. So we have to sort of scroll down. Got powder, keep on going. Sim base, it's DD Sim base ointment, 500-gram container. So we want to click on that. The quantity here is the remainder of the 60 grams total, or 54 grams, right? Since that's all we're making. 54 grams total. Simbase, DD Simbase ointment, 500 grams. No, it should be Simbase. We've got, did you type DD first? Okay, keep going. It should be down alphabetically. So it's going to be DD Simbase. Yep, there it is. Got it, okay. So double click on that, automatically goes to the compound drug ingredients. Save that. 54, we calculated that earlier. Look in the lab. So we have to calculate that ahead of time. So I'm going to calculate a price. So this is costing us in raw materials, not in technician time or anything else. In raw material, $744 and $591, which is going to be $1335 total to make this. Obviously, we're going to mark it up, but it's what costs us. Now we have this. Okay, the drug is there. We can close this. So what you want to do first, though, is go back and look at our instructions and look at the assignment. And what we want to do, provide a print screen of the compound drug in step 8. So we're done. You have screenshot that, then fill out the rest of the lab report. So the rest of these labs are the same thing in this week. You're going to set up, going to do compounding. You're going to set up a drug and then follow their directions. Even if they look a little squirrely, follow their directions. Okay. So Amber, are you still with us?
Yeah.
Okay, I don't know. I know she's not feeling good. So, so that's, yes. Mm-hmm. Yeah, yeah. Okay. And then you have to do the beyond use date yourself, because that you have to calculate based on the guidelines. Well, first off, you won't have an FR record number. We don't have that. Prescription number or ID assigned. Okay. So the ID number, you've got, let's see, expiration date, actual net measurements, and quantity that you used. So right there between the name and strength of compound. Quantity, well, that's what you put in. It's what you put into the formulation. So we put that on the screen when we created the drug. Yeah, that's from just what we just now did. Okay. Okay. No. There's a mix of what we actually did and the information on the packages. Okay. So, see what part. Let's look at no, that didn't write. Okay. Week 3. Okay, let's look at number C right quick. Here you're putting together something called medicated troches. TROCHE is pronounced troche. Basically, those are lozenges, little small lozenges. Often they are made out of the same material, things like suppositories are made out of, cocoa butter and that sort of thing, to melt easily. You're doing this for your patient who has some sort of oral problem that they're dealing with, and they're medicated lozenges. One of the things that you're going to do is you'll see some numbers there. Just follow their directions. And what you want to do is a label here. So we're going to go to lab 25 briefly, and look at what that label is at the end of step 6. So here we are, and we're going to go to, we're just going to look. We're not going to do step by step here. So I want to go now. I need to go further into this lab. This isn't right. Okay. Something wrong here. Okay. Okay. So we want lab 25. We're going to, in this case, we're preparing a lozenge. I want to go and see what step 6 is before we get there so that we can, okay. So what you're going to do is basically the end of step 6 is to go back and pull back the drug that you created along with the compounding information, and that's the screen you take a shot of. Okay. And that's the end of that particular lab. Let's look. at what's next, lab 26. We're going to be looking at oral liquids. So let's go back to here and go to lab 26. All right, okay, here I went too far. Okay, oral liquids. You've seen a lot of oral liquids. You know, the amoxicillin suspension is one of the most common drugs that's ever prescribed, but there are many other liquid drugs. So in this particular case, we're going to do a mouthwash, magic mouthwash, with the SIG being swish and swallow. Okay, and there's a label identifier here. So it's going to be a mix of Benadryl or diphenhydramine, simethicone or Maalox. So you want to look up Maalox. Nystatin, which is an antifungal, and then this viscous solution, okay? So you're going to look at this, and here are the amounts you're going to use. You look for diphenhydramine, and I'll give you a little lesson here. There's the reason that the AMIN at the end is capitalized is not because it's a different drug. It's because it's what we call tall man lettering. Diphenhydramine and other drugs have similar names, and this tall man lettering makes it easier to get the right drug. Okay, and we use that on a lot of different products. And again, you're going to use lab 21 as a reference. They seem to have taken an old version of this and used lab 22 as their start. So you're going to do a list of magic mouthwash is what you're going to call it. Okay, you're going to do that. The amount of material you're going to make is 240 milliliters. So somehow or another, what you want to do is use these things to do that calculation. So we're going to create the drug, and then we're going to start looking at how to do a proportion. You want, if you look at this, our first ingredient here is the diphenhydramine. We're going to take the 480 milliliter package size, and what we want is something that has a total of 240 milliliters. So you're going to do some proportions here. Okay, they're going to be equal amounts of diphenhydramine, of Maalox, and of nystatin. Okay, equal amounts of those, and then a proportionally smaller amount of the viscous solution, 2% oral topical viscous solution. So when you are doing the search for these things, remember that you're going to have to do these calculations. They help you with this. You'll need 60 milliliters of one. You'll need 60 milliliters of each of the first three, because there's the same proportion. And then that'll give you 180 milliliters. And then you'll need, the rest of it will be of the viscous solution. Okay? So actually it'll be 60 milliliters of each one when you do the quantity in that screen, the drug compound screen. Okay? So you'll put that together, and then I believe that's what you are supposed to take a screenshot of. Let me take a quick look. Step 7, yeah. We go back now, come on. Or that wrong one. Okay. Getting tired. What we want is, yeah, here. If we go back here, you'll find the at the end of that, you'll find whatever you called it. They've suggested KA magic whatever for your name. You can call it whatever you want. But just take a picture of that once you get it formulated. So the rest of the lab is not going to be done. All right. So questions? So this ought to be, basically a bunch of work, but basically the same thing several times, but using different kinds of things. What you're going to have is on this particular assignment, let's go down and look. Yeah. So you're not even going to be doing a formulation report on this. So, but again, this is a liquid formulation. So it has a 14-day date on it. So think about that too. All right, so do you have any other questions? Have I worn everybody out thoroughly? Why don't you flip the lights on, Felicia, please? And I will. Okay, so Amber, do you have any questions?
No, I don't. Did you hear that?
I'm not hearing you, so let me see. Do you have any questions?
I do not right now.
I can't hear you, so let me see if we've got a problem with muting. Okay, great. That's the way to do it. Great. Okay. Okay, that's fine. You can email me with any questions that you do have. I hope you are feeling better and can get some of this work done. And just remember that Nate and I are willing to work with you and make sure that you can do well in these classes. You're welcome. Okay, so I'm going to cut off this recording and I'm going to stop the meeting. So you guys can get on with what you're doing and feel better soon.
Thank you.